Hey, I'm Katie with See Me, Unlocking Resources for the Neurodiverse. Check out this video on medical cannabis and the benefits of using it to treat autism spectrum disorder. Hope you enjoy. If you have any questions, let me know. Thanks. Just wanted to do a quick video to talk about medical cannabis. So my son Adley, he's 6 now. When he was 3, he was diagnosed with severe ADHD and disruptive mood dysregulation disorder. At right around 5, they added a diagnosis of autism and now severe anxiety. So we started Adley on medications around the age of 3.5. He was about to turn 4. And his initial medications included just stimulants for the ADHD because that was really all that we knew that was going on at that point, just because we didn't have the understanding of some of his other diagnoses and how they present. So we tried Adderall, we tried Concerta, we tried Vyvanse. I mean, we tried every kind of stimulant you could dream of, and it's like he would they'd work good for like 3 weeks, and then he'd be back to where it didn't even seem like he was medicated. And that was kind of the case through every medication. We'd get him to such a high dose that it was no longer indicated for a 6-year-old, or he was 5 at the time. And then we'd see, once we got on a higher dose, his sensory issues would be exacerbated. So like he couldn't even leave the house without noise canceling headphones on. Extreme paranoia. Like at one point he was afraid to ride in the car across a bridge because he thought the bridge was going to collapse. We went on a walk once and he thought things were going to jump out of the woods and get him, and it was middle of the day. So lots of like just extreme panic when we'd be on higher doses of stimulants. So we tried non-stimulants, and we tried several non-stimulants as well. And with how severe his ADHD is, it didn't seem like the non-stimulants even helped him. Mind you, as we progress, we're no longer just seeing extreme hyperactivity. Now we're starting to see an increase in the sensory issues, more violence and aggression. So he has like 0 tolerance for frustration, 0 tolerance for delayed gratification. He's very rigid thinking, so if he thinks something should look, sound, or feel a certain way, and if it doesn't play out just like that, he would have intense meltdowns that would last sometimes up to a couple hours. We've seen a lot of violence towards us and towards our home, material items. So like we've got several holes in the walls, broken TVs, lots of broken items. He's bitten, scratched, pinched, everything to us. He's drawn blood on us. He's given us black and blue eyes numerous times. So through this nonprofit, I actually heard from another mom whose child had nonverbal autism, was struggling with the more severe symptoms of autism. And she told me that they had tried medical cannabis and that their meltdowns and aggression went away within like seconds of going on it. Now, at that point with Adley's mental health diagnosis, I would say that the physical aggression was the biggest symptom that we were trying to treat. It was making it so he could not be successful in daycares. Nobody would accept him. It was making it so our relationships at home were very fragile. We had to take everything out of his bedroom with the exception of his bed, so that way we had a safe place to put him when he was having these meltdowns, because if he was anywhere near anything that wasn't pounded down to the ground, it became a weapon. And he would use them to throw at us. He would use them to throw at things like the TV or the windows to try to break. And it was just too much going on around him. You could tell that it was way too overstimulating. So at that point, we took everything out of his bedroom and we would put him in there, and he would be screaming to get out, and we would just stay quiet and kind of leave him in there, because we could tell he just needed quiet. He needed no stimulation, and he needed just a break from everything that was going on. And it would still take him like an hour, to calm down and get to a point where he could come back out of the room. But a lot of violence and a lot of aggression. So I was like, hey, cool, like maybe we could try medical cannabis. Now at this point, I was on medical cannabis because I have chronic pain issues, and same thing, I had tried numerous pharmaceutical medications, and the amount of side effects versus how helpful the medication was just didn't equal out for me. So I went on medical cannabis, and my pain was significantly reduced. So I'm like, all right, well, we got to try it. We already tried all the stimulants, all the non-stimulants. And he's also been in therapy since he was 2. We've done play therapy, family therapy. occupational therapy, and it just felt like we were spinning our tires. So it kind of felt like by addressing the ADHD, even though we thought that was the most severe thing, we weren't really seeing improvement. So then we started to question, is the ADHD the biggest thing? And that, like I said, that was when we got the diagnosis of autism and the severe anxiety. And then we started thinking like this anxiety is probably the thing that's triggering a lot of this fight or flight reaction. So we went to a clinic that we had heard good things about that, had a reputation for certifying kids with autism for medical cannabis. And she met with Adley the best she could. He was like running in and out of the clinic, very dysregulated. And that was at a point where he was eloping a lot. So it was really hard to even keep him in the clinic. And right away she said, I absolutely think cannabis would be beneficial for him. And she educated us on cannabis with autism and kind of what's been shown to be helpful. One of the things she said is a higher THC level is usually not helpful for people with autism, and it can kind of lead to more like paranoia and hallucinations. So she recommended higher CBD, lower THC. So she certified him in medical cannabis, and we registered him and we started him on cannabis. Now I will tell you, the day we started Adley on medical cannabis, the violence, extreme violence and aggression, it went away. So we went from being assaulted for hours a day, not being able to go anywhere because if you tried redirecting him at all, he would become assaultive, to occasionally he'll like toss a toy at us. But I was going to work with black and blue eyes. I had bite marks and bruises all over my arms, and I don't have that anymore. He had used his hockey sticks as weapons to hit grandma, to hit dad. Just a lot of extreme violence and aggression, some homicidal thoughts. And all of that pretty much, he still has little bits of aggression and little bits of, dysregulation for sure, but it's not like it was. It's not like where he wants to grab a knife and try to kill you. And I'm not saying that to be exaggerating. That was how his thinking was before he went on the cannabis. So I'm a strong believer in medical cannabis. It's given us a piece of our child back. Adley before cannabis had extreme lows, and his lows were like, I want to kill you, I hate you, just very, very, very dark. And then his highs were like extreme hyperactivity, extreme bouncing off the walls. His volume was always high. He was never like able to have a calm, quiet conversation like this. Everything was yelling and screaming, even if you were like, right next to him. I don't think he really heard his own volume, for lack of better description there. But so now with the cannabis, we feel like we kind of have this middle ground. Like Adley's been able to sit and watch YouTube videos. He's been able to sit and watch movies. And that's something he was never even remotely able to do before. He couldn't be still for that long. And we still have ups and downs, but they're not like so far up or so far down. Now it's just these little fluctuations. He still needs plenty of alone time. There's still a lot of struggles, don't get me wrong, but I feel like it took us from living in constant crisis with Adley to having, moments and days that are difficult, but also having joyous moments with him. And I will confidently say before the cannabis, we didn't have a lot of joyous moments with Adley. It was all day, every day crisis, to the point that by Saturday morning at 9, we couldn't wait for it to be Monday morning so we could go back to work. And, we love our child. It's not that we just didn't want to be with him. It's that it was heartbreaking. It was exhausting. It was hurtful. It's hard to watch your child struggle so much and to not have the skills or the tools or the knowledge of how to help them. So the cannabis gave us back moments of being able to enjoy being with our child. So, I know that it's super controversial. I get that. I'm a substance abuse therapist myself, so I fully understand the apprehension of introducing some of these mood-altering substances to our children. However, after all of the different pharmaceuticals, the amphetamines that were just not showing the type of results that Adley needed to be safe and to be able to function at home and at school and in recreational settings, we knew we had to at least give it a shot. Like we were bordering on we had been to the hospital. We were looking for inpatient treatments. We weren't sure how to keep him safe in our home anymore. So it was kind of like, we have to try something if we want to be able to keep Adley home and reduce the trauma on him when it comes to struggling with his symptoms of autism, ADHD, anxiety, and disruptive mood dysregulation disorder. So he's been on cannabis for, I mean, we're close to coming up on I think it's been like 9 months, 8 or 9 months, and he does really well with it. He takes the pills. He takes it 2 to 3 times a day. We do definitely take vacations from the lunchtime dose at times when he's home, but for the most part, he takes it 3 times a day, and it's been amazing. If you have any questions about the medical cannabis, definitely comment below and I will answer them, because we certainly don't have all of the answers, but I know what's given me joy back with my child, and I know it's given my child back some joy and some self-control in his life, and I know what it's like to be absolutely lost. So like I said, if you have questions, comment below. Don't forget to like or subscribe to our channel. We're kind of getting things situated here with Simi, so we're hoping to be able to do some more videos here and there. So if there's topics you want to hear us chat about, definitely let us know down below. Thanks, guys. Hope you have a super day. Stay healthy.